Hello and welcome to part 2 of this 3-part interview series where we'll be talking about PCR methods for gene therapy bioanalysis. We're going to jump straight back into the applications of PCR-based methods in gene therapy development. So can you talk us through how you would use each of those methods for vector characterization and quality control?
So qPCR is really good when you need a wide range or a high assay linearity. So you're not quite sure of what your concentrations of your samples are going to be. Where dPCR and ddPCR gives you much more of a targeted approach and a much narrower assay range, which could be a limitation. But when you're really looking at, titering or characterizing vectors in terms of drug product development or drug characterization, that's really a great source or a great platform to be able to really hone in on those. And so that's a great opportunity to use it.
How different is this approach when you're performing something like a biodistribution or a persistence study? And how does some of that data inform patient safety considerations?
So the qPCR method, really, you can use the same assay for both biodistribution or persistence or shedding studies because you're really capitalizing on the ability to have a wide assay range as well as being able to detect very low concentrations. So qPCR is very sensitive in that it goes down to the femtograms, so 10 to the minus 15, very low. But you do have to think about, any sort of inhibitors or things like that. So that does go into part of the method development of making sure you're optimizing for your specific matrices that you're looking at. Where dPCR and ddPCR both have a more limited assay range or a smaller assay range and will be better suited or could be better suited for a persistence or a viral shedding study because it's able to look at a more targeted range. It's also able to utilize or is more effective at overcoming possible inhibition. So you can take that approach of doing that direct PCR from the primary sample itself. When it comes to biodistribution, though, dPCR and ddPCR may be a little less suited in that you might have a wider range of concentrations that you're expecting across the different tissue types or where the targeted tissue might actually be. In terms of how does this impact patient safety or patient data, the shedding data is actually used, or the shedding information is used most often by manufacturers to inform clinicians of what may be the typical time that patients could see cessation of shedding the biovector. Where this then impacts, or cessation really impacts the patient, is that they no longer have to use any sort of prophylactic or mitigation against contact because they are no longer shedding the viral vector of the drug therapy they're under.
A question that came to my mind when we were preparing for this conversation is, where do you see some of the biggest sort of missed opportunities are in this field? Are there applications where PCR-based methods should be the go-to and they simply aren't currently?
I don't think there are missed opportunities, but I do think there are possibilities for using variations on a PCR or PCR-based approach. And one that's coming to mind is a combination of a PCR and ELISA, so hybridization ELISAs. So in terms of a go-to platform, as qPCR being, at the end of the day, the scientist needs to think about the context of use of what the assay is intended, what type of inhibitors or matrix are you having your samples being reported in, how rare is your targeted reference sequence or your sequence that you're looking at, and then your ability to be able to produce reference standards or produce the materials that may be needed for a quantitative or an absolute. At the end of the day, as long as you're able to scientifically justify your approach and your understanding of why you're using it, really any of the 3 approaches or any of them can be the go-to approach.
That's great, thank you. So we're going to wrap it up there for part 2, but please join us for the 3rd section of this interview, where we're going to look at some regulatory considerations and some validation strategies for PCR-based methods in gene therapy bioanalysis.